Hello and welcome. My name's Dr. John Teh. I'm a practicing cannabinoid clinician and lecturer in medicinal cannabis based in Brisbane, Australia. Today we're going to be talking about the endocannabinoid system. Throughout history, cannabis has been used as a medicine. And more recently, in 1964, the THC molecule was isolated by Dr. Raphael Mahulem. In 1998, cannabinoid 1 receptor was isolated, and in 1990, cannabinoid 1R was cloned. This led to the discovery of what is today known as the endocannabinoid system as recently as 1992. So everybody's heard about THC, and I'm sure many people have also heard about CBD, that is tetrahydrocannabinol and cannabidiol. These are the two main plant-derived phytocannabinoids naturally occurring in the cannabis plant. These are analogous to endocannabinoids derived and produced within our own body's systems. The two major endocannabinoids found in our body are anandamide and 2-AG or 2-arachidonyl glycerol. These two molecules are secreted and created on demand from the postsynaptic receptor. I'll go through this in a little bit. So what is the endocannabinoid system? The endocannabinoid system is a homeostatic regulatory system influencing multiple physiological systems. Basically, it's the master system, or system which overlays all of our other components of our bodies, physiology and metabolism, and ensures they stay within the correct homeostatic frameworks. These systems include immune functioning, cardiovascular functioning, metabolism, inflammation, sleep and wake cycles, thermoregulation, pain, learning and memory, digestion, appetite and hunger, stress, neural development, reproduction and fertility, emotion and mood, neuroplasticity, development and protection, and growth and osteogenesis. Basically, everything. Endocannabinoids and their receptors are found throughout the body, in the organs, connective tissues, glands, and immune cells. In each tissue, the cannabinoid system performs different tasks, but the goal is always the same: homeostasis, the maintenance of a stable internal environment despite fluctuations in the external environment. From our birth to our death, the endocannabinoid system is intimately involved. Endocannabinoids are found at highest levels at birth. They are associated with the suckling response and are passed in the mother's breast milk, and are deeply involved with parent and child bonding. Not only that, cannabinoid systems and endocannabinoids are found in all animals, mammals, reptiles, fish, etc., and have been isolated right down to mollusks, so they are an integral part of all physiological systems in all animals. This is Dr. Raphael Mahulem. He is the Israeli scientist noted for discovering the THC molecule in 1964. He's a much respected man and is seen as the grandfather or godfather of medicinal cannabis. Here's a quote from him. The ECS or endocannabinoid system is an essential modulatory and protective system which allows the human body to adapt to various internal and external stimuli. The ECS prevents excessive reactions by other systems in the body. Another quote from Dr. Mahulem. The endocannabinoid system is a modulatory, inhibitory system rather than a basic system. Its role is to modulate other neurotransmitter systems by inhibiting them. The ECS determines the activity of other systems. It is a highly active ECS that reduces the activity of other systems or vice versa. Depending on the nature of the inhibited global system, observed effects may differ. Therefore, depending on the disease and the physiological system involved, either inhibition or activation of the endocannabinoid system may give beneficial results in patients. This brings us to the mechanism of action of the endocannabinoid system, and this is what is referred to as retrograde inhibition. The anandamide and the 2-AG, the endocannabinoids produced by our body, are produced on demand by the postsynaptic neuronal terminal. This is a diagram of how this works physiologically, but I'll describe it briefly for you. As a neural transmission descends down the neuron and hits the synaptic cleft, it releases the neurotransmitter associated with that synapse. Considering the neural response or activity is within normal range, the nerve impulse continues on down that synapse. However, if, for instance, the triggering of that neuron is too high or in an excited state, it will trigger the release of anandamide from precursors within the cell membrane, the postsynaptic cell membrane, which will then go back across the cleft and interact with the cannabinoid receptor or CB1 receptor on the presynaptic terminal. This then instigates a cascade of events which will suppress or inhibit the transmission of the original neurotransmitter, thereby downregulating this system. So in this way, depending on whether a system is excitatory or inhibitory, the activation of the endocannabinoid system by either endocannabinoids or phytocannabinoids, plant cannabinoids, results in an inhibition of that system. However, if that system is inhibitory, it will result in an excitatory response, and if that system is excitatory, it will result in an inhibitory response. Additionally, binding to the cannabinoid receptors is not 100% all or nothing, but rather has various affinities of binding resulting in a mechanism of action. This allows for fine control of the endocannabinoid system over all the other physiological and metabolic systems. So, retrograde inhibition. It's a very important concept. How do cannabinoids affect so many physiological systems with this aim of homeostasis? As noted, this is because cannabinoids act in a retrograde or backwards fashion. The endogenous cannabinoids, anandamide and 2-IG, are produced on demand from the postsynaptic receptor. These then act on the cannabinoid receptor on the presynaptic terminal, downregulating release of the neurotransmitters associated with this terminal. Action of cannabinoids thus depends on the action of the neurotransmitter it affects. Please note, exogenous phytocannabinoids, THC, act in the same way as endogenous cannabinoids. In this way, the effect of cannabinoids can be either sedative or stimulatory depending on the neuronal side of action. So basically, what does this all mean? It means cannabis can have a multitude of physiological effects depending on the site of action. Cannabinoid receptors. There are two main types of cannabinoid receptor. Cannabinoid receptor 1 and cannabinoid receptor 2, CB1 and CB2. These are similar in structure and are 7 transmembrane G protein receptors. CB1 and CB2 receptors act to inhibit on the presynaptic terminal. Here we have a three-dimensional image of a cannabinoid 1 receptor. So as I said, there are two main types of cannabinoid receptors. The CB1 receptor and the CB2 receptor. The CB1 receptor is found mostly in the brain and central nervous system, and the CB2 receptors are found mostly peripherally, are involved with inflammation and immune modulation. The CB1 receptor is located mainly centrally in the central nervous system. The binding of THC to this receptor is responsible for the psychoactive effects of cannabis. It is the most widely expressed G protein receptor in the brain, being 10 times more numerous than the opiate receptors. It is also expressed peripherally and is found in high concentrations in the cortex, basal ganglia, hypothalamus, cerebellum, amygdala, and spinal cord. Importantly, and notably, cannabinoid receptors are absent in the respiratory and autonomic centers of the brainstem. In this way, it is not possible to cause death via respiratory depression. This is very unlike opiates. CB2 receptors, cannabinoid 2 receptors, are found mostly peripherally and associated with immune function and inflammation. They are expressed on the cell membranes of T cells, B cells, and macrophages, the main cells of inflammatory response, and are associated with immune function and inflammation. Expression is inducible. This is saying that receptor concentrations of CB1 and CB2, especially in this case, receptors are upregulated in response to inflammation or tissue damage, cell death, hypoxia, etc. CB2 receptors are also expressed centrally in glial cells and have a role in immune modulation function and inflammation, i.e. neuroprotection of the brain. There's another instance of the CB1 and 2 receptor diagrams. And importantly, all cannabinoids are neuromodulators. They affect the rate of action of the neurotransmitter release and degradation of cells. This is an image indicating cannabinoid receptor distribution. This is another diagram indicating areas with high concentrations of cannabinoid receptors. CB1 receptors in purple here are seen prominent in the brain, lungs, muscles, digestive system and reproductive systems. CB2 receptors, indicated in yellow, are found in the bone, spleen and skin, peripherally in the immune and inflammatory responsive areas. And CB1 and CB2 receptors are found throughout in the immune system, the liver, the pancreas and the bone marrow. Cannabinoid receptor central nervous system distribution. Cannabinoid receptors are densely distributed throughout the central nervous system. They are notably absent in the respiratory centers of the pons and medulla oblongata. So this is once again a point to reiterate that cannabinoid medicines are very safe. There is no possibility of respiratory depression at any level of medication. This is very unlike the opioids. And here we see an indication of the lack of cannabinoid receptors in the brainstem area associated with respiration. This is a diagram indicating areas of CB1 concentration, so found in the basal ganglia associated with movement and cerebellum associated with movement, cerebral cortex, higher cognitive function, the hypothalamus associated with appetite, the hippocampus associated with learning, memory and stress, in the spinal cord and responsible for peripheral sensation and pain sensations, and also importantly in the medulla, and this is where we get our chemoreceptor trigger zone, and this is the site of action of cannabinoids on the cannabinoid receptors associated with nausea and vomiting and antiemetic effects of cannabis. Another one indicating central nervous system locations is CB1 receptors. So once again, the hypothalamus, temperature regulation, water balance and reproduction, the amygdala, emotional states, response, fear, the hippocampus, learning and memory and stress response, the brainstem, sleep, temperature regulation, water and balance responses, the spinal cord, pain and other sensation, the cerebellum, movement and coordination, and the cerebral cortex, so complex thoughts and memory. Another diagram of CB1 receptor distribution. So as you can see, there are a lot of cannabinoid 1 receptors throughout the central nervous system. So what can stimulate cannabinoid receptors? Well, cannabinoids basically. Endogenous cannabinoids or endocannabinoids, which have been mentioned, which are the two main ones are anandamide and 2-AG. As mentioned, these are produced by our bodies from the postsynaptic cell membrane, and these come from the precursor of arachidonic acid. I'll go into this a little more detail later. Phytocannabinoids are plant-derived cannabinoids. So these include the well-known tetrahydrocannabinol or THC and cannabidiol or CBD, though there are over 144 discovered cannabinoids. Additionally, cannabinoid receptors can be stimulated by synthetic cannabinoids. These are pharmaceutically synthesized, but I find they're not very effective therapeutically in clinical practice because they don't have the fine level of finesse or modulatory ability of phytocannabinoids with their variable receptor agonism. So there's one example here of a synthetic cannabinoid, rimnabinant, which was a complete CB1 antagonist. Now, this was designed to be used as an appetite suppressant, which in fact it did do very well and resulted in weight loss in humans. But as a side effect, and the complete antagonism of the CB1 receptor resulted in effects in the central nervous system associated with depression, anxiety, fear, and in some cases suicidal intention and, in fact, suicide. So this is one synthetic cannabinoid that was quickly removed from the market. So this is just an indicator of a diagram indicating the other major cannabinoids. As I said, there are over 144 discovered so far. But the two main ones that we are concerned with at this stage are THC and CBD. The other cannabinoids will be covered in another part of my lecture series. So here we go again, the main phytocannabinoids: tetrahydrocannabinol, cannabidiol, tetrahydrocannabivarin, cannabinol, cannabichromene, cannabicyclol, and cannabigerol. So these are the other main phytocannabinoids found in the cannabis plant. And this is just a diagram indicating the various cannabinoids and their medical uses, which we'll cover more later. There are other cannabinoid receptors in the human body besides CB1 and CB2 receptors. These include other G-protein receptors, vanilloid receptors, serotonin or 5-HT3 receptors, glycine receptors, and PPARs. These are some of the atypical cannabinoid receptors that have been discovered so far. And it seems likely that many more will be discovered as research continues. So I think that these atypical receptors have an effect in the finer modulation of the effects of cannabis in our bodies and our endocannabinoid system. So receptor variation, when considered together with the myriad of phytocannabinoids and as yet undiscovered endocannabinoids, points towards the multifaceted, intricate, multi-level control of the ECS and its potential for medical treatment efficacy. This is something I put together to demonstrate the fact that rather than turning on and off a receptor like rimnabant or a synthetically produced cannabinoid, the variation in receptors and the variation in receptor agonism and the variation in the cannabinoids present in the plant and the endocannabinoids in our body allow for very fine-tuning modulation of all the other systems of which the endocannabinoid system regulates into a state of homeostasis. So basically the endocannabinoid system is responsible for maintenance of our body in a state of health, and it is the system which the phytocannabinoids we use as medicinal cannabis interact with our body to produce a healing effect. Importantly, we must have a healthy endocannabinoid system to get a good response and a good healthy effect from our body's endocannabinoids and the introduction of plant or phytocannabinoids. So how do we support and maintain our endocannabinoid system? The main precursor for our own endocannabinoids is in fact omega-3 fatty acid. So this is found in the cell membranes throughout our body, and this is where the precursors for the endocannabinoids 2-AG and anandamide come from, out of the cell membranes. So it is important that we consume adequate quantities of good oils to support this function. This basically means fish oils or plant-based derivatives such as hemp seed oil, which then in turn are converted into omega-3, 6 and 9 in the correct ratios for our bodies to use. In our society, we also have a predominance of omega-6 oils being consumed in the form of polyunsaturated vegetable oils. So this is probably one of the main indicators that we should be consuming adequate amounts of fish oil supplements to support our endocannabinoid system. Other ways to support and maintain our endocannabinoid system include avoiding inflammatory foods, the ingestion of probiotics, kombucha, kefir, and other naturally fermented foods, exercise, meditation to relieve the stress response, physical therapies such as massage and yoga, phytocannabinoid supplementation, of course the basis of medicinal cannabis, and to decrease stress levels or cortisol levels. A lot of the references here coming from Enhancing Your Endocannabinoid System by Justin Kanda, who's a respected cannabinoid clinician based in California, America. So arachidonic acid is the precursor of our endocannabinoids. So as I said, this is basically we need omega-3 to support this metabolic chain. And the correct ratio of omega-6 as to omega-3 oils is imperative as well. So the correct ratio here is 3:1. Omega-3 is required for the correct cannabinoid receptor functioning, and a lack of omega-3 results in presynaptic decoupling of the CB1 receptor from its G protein, and basically disabling the receptor. So even if we don't have enough, if we have enough endocannabinoid receptors within our body, cannabinoid receptors, if we don't have enough omega-3, we'll get decoupling and disactivation or inactivation of the CB1 receptor, thereby decreasing our response to our own endocannabinoids and, of course, our phytocannabinoids or medicinal cannabis. So yes, as mentioned, the best source of this is organic fish oils, free-range meat, fish and eggs. And if you are vegetarian or vegan, plant-based sources are your next best option. So hemp seed oil, flaxseed oil, chia and walnuts. The ALA or alpha-linoleic acid found in the plant-based sources must be converted to EPA or eicosapentaenoic acid and DHEA. These are the fatty acids that are found in fish oils and are used in our body to create arachidonic acid, to fill out our cell membranes with this arachidonic acid, which is the precursor to our endocannabinoid production. Once again, we have to have the correct levels and ratios of omega-3:6, and if we don't have the all-important omega-3 in our diet, we get decoupling of the CB1 receptor from its G protein, and this results in inactivation of the receptor and decreased response to endocannabinoids and phytocannabinoids alike. So this is just a little diagram indicating the way in which our bodies use omega-3 and omega-6 and their sources. Endocannabinoid system and probiotics. So support of our endocannabinoid system with the use of probiotics is very important. 70% of the immune system resides in the gut-associated lymphoid tissue, and as mentioned, the immune response and inflammatory response systems and tissues are intimately associated with the CB2 receptor. So anti-inflammatory and immune supporting function of probiotics enhances the endocannabinoid system, and consumption is associated with improved cannabinoid signaling. So the best sources of these probiotics are fermented foods such as kombucha, kefir, natural yogurt, sauerkraut, kimchi, tempeh, and miso. Other supportive measures which we can take to enhance our endocannabinoid system include the consumption of curcumin found in turmeric, piper nigrum or black pepper with the important terpene found in this black pepper, beta-caryophyllene, which has a very strong affinity for the cannabinoid 2 receptor and associated with an increased anti-inflammatory and analgesic responses. Cacao or cocoa contains small amounts of anandamide. Echinacea activates the cannabinoid 2 receptors with strong affinity. And flavonoids such as red clover, soybean, and Camellia sinensis or tea actually inhibits FAAH, which is responsible for the breakdown of our endocannabinoids. There's a few other things here, such as wormwood, ruta graveolens, and copal incense, which have been seen to increase the activity of the endocannabinoid system. And importantly, other things that we can do to support our endocannabinoid system are to decrease stress. So this includes exercise, yoga and meditation, massage and physical therapies. So basically, if we decrease the stress in our bodies, we decrease cortisol production, and then we decrease the demand on the endocannabinoid system to bring that cortisol system back under control, to bring our stress response back into homeostatic levels. And that, as I've mentioned earlier, is the function of the endocannabinoid system. So thank you very much for listening today. That was a brief introduction to the endocannabinoid system. I will be making more lectures in this series to extrapolate on the use of phytocannabinoids as plant medicines, or medicinal cannabis as plant medicines, to support our endocannabinoid system and produce healing effects in our bodies. I will be looking at this from a very clinical perspective, how we use the medicines, the doses, the rates, the systems involved, and we'll be looking at them all separately in the lecture series to come. So thank you for joining me here today. I'm Dr. Teh, and I'll see you next time.